our doctors in the clinic will always tell us that before you can know that there's something wrong with the system of the body, that's before you can know the abnormal, you must know the normal, right? Okay, so now we actually taking a series of lectures on chest x-rays, and we're trying to like build the student towards trying to interpret x-rays for disease conditions, all right? But before then, at least you guys need a guide towards interpreting the normal chest x-rays, okay? So this is like a guide towards interpreting the normal chest x-rays. We'll tell you guys the things you are supposed to note if you see a normal chest x-rays, okay? And if you don't see these things, all right, then that means there's a disease condition on ground. All right, so the guide toward a normal chest x-ray, that's what we're looking at. So in interpreting a standard chest x-ray, it is what imperative to have a systemic and standardized approach towards this, okay? And this should be based on an assessment, first of the anatomy, then of physiology. All right, so you access it based on what? The anatomy, then physiology. All right, so in a standard chest x-ray, the overall heart diameter is what? Normally less than the transverse diameter of the thorax. Do you know what that means? The diameter of the heart, okay, should be less than 50% if I'm calculating from here. It's a normal chest x-ray, okay? In cases where you're having the heart as big as this, the diameter is now what? More than what? 50% of the more than 50% of the transverse diameter of the thorax. Do you know what that means? That simply means what? The heart is enlarged. That's a cardiomegaly. Okay? Now, the heart overlies the thoracic spine roughly 3/4 to the left. Okay? To the left of the spine and 1/4 to the right. This is trying to tell you guys the location of the heart. Okay? So it is what? 3/4 to the left. That means what? The heart is much more to the left. Okay, so if you have the heart being enlarged at the side more, what does that entail? That entails that there's a right ventricular hypertrophy. Then if you have the heart occupying, they say that it is 3/4. So if you have the heart occupying 4/4, what does that imply? That means there's a left ventricular hypertrophy. Do you understand? So this is the normal. If you know the normal, you can know the abnormal, right? Now, the mediastinum is narrow superiorly, okay? Now, it is below the aortic arch, the pulmonary hilum are seen slightly higher on the left than the right. So if you see any of these informations being inverted, okay, just know that there's what? An abnormality. Okay, so you can see a very good standard normal chest x-rays. You can see the clavicle up there. You can see the great vessels of the heart. You can see the heart down here. You can see the diaphragm. Okay, and everything we've spoken about in this lecture is actually shown off. All right, this is a normal chest x-ray. Okay, so this is a guide to actually what? Knowing the simple things that you're supposed to know on a normal chest x-ray, that if you see them being inverted, you know that there's an abnormality. Okay, so this is a guide to interpreting the normal chest x-rays. See you guys pretty soon.